So many people suffer from heart disease, but it's totally preventable.
I know, that's why Pasadena Cardiologist Dr. Jacobi is here with us today. You can talk about some of those tips and tell us, how do we prevent heart disease?
So thank you for having me. I really appreciate it.
No, this is great. This is very good. This is what people want to hear.
Yeah, I think most everybody has at least heard this story or knows somebody who's had a heart attack or a stroke, and 85% of the time, at least 85% of the time, that's preventable.
That's a large number.
Yeah.
That's a large number.
Yeah. And, you know, a lot of it is basic behaviors that we already know, diet and exercise. And what I found in practice is that we, as doctors, unfortunately don't have as much time to spend with patients as we used to. Right. Because if a physician is able to spend more time with patients, then we can educate them on why it's beneficial and how much of an impact it has. For instance, if you walk the recommended 30 minutes 5 times a week by the American Heart Association, you decrease your chance of dying 25%. Now that's about as good as any medication you get. If somebody smokes, for instance, and they quit smoking, right, within 1 year, they decrease their risk of a second heart attack 50%. Wow. Again, that's as good as any medication that I would ever prescribe to a patient.
And they say that about diet as well. And I know we're not talking about diets, but if you just cut out soda, didn't change anything else in your lifestyle, just cut out carbonated drinks with sugar, your life would change. You'd lose weight. So yeah, no, what you're saying is absolutely true.
And the weight issue is
huge. I mean, if you look at it, I think right now in America, obesity is the #1 health epidemic.
It's
I mean,
huge.
one out of 3 Americans is obese, and and if you were to wave a magic wand, so to speak, and take out all the obesity in the U.S., you would save billions of dollars in this country in healthcare spending.
Right.
So you provide concierge medicine. Mm-hmm. Tell me a little bit about what you do with one of your clients, one of your patients.
Okay, for instance, I had a gentleman come to see me December 2014. He was 71. We assessed his risk of a heart attack, and his risk of a heart attack at 5 years was 20%. Now, a lot of this assessment involved inflammation testing, which you don't typically get at a doctor's office.
I understand that, and that's something important that you provide.
Yes, yes. And, but this also served as a big motivation tool for him. And he had struggled with weight all his life. He had had gastric bypass, lost and gained weight. He'd done fin-fin when it was when it was legal, lost and gained weight, done Weight Watchers, lost and gained weight. So every time he had lost and gained weight, put him on a program. In 1 year, he had lost 70 pounds. And before this, he couldn't even walk a mile because of pain in his right hip. Afterwards, he could walk 5 miles a day and typically does it every day.
That's great. My dad had bypass surgery, and the doctor, we met with the cardiologist, and he says, you got to change the way you eat. You got to watch the salt intake. Yeah. And my dad still goes out and eats in restaurants, and I'm trying to explain to him that there's nutrition menus that you could ask for to look at that. And you should think about before ordering the ribs, and that salad might be worse than the ribs.
Yeah, and part of the issue is that when we have like a rib or something sweet or something we know that's not nutritious for us, it's not like you have the heart attack right when you're eating it. No. You have the heart attack 6 months later because of continuing to eat like that. And what I like to do is provide a program where it's systematic and it's scientific, and we hold people accountable. So every time they are doing that, we let them know, hey, you need to change your life.
How do you convince people to change though? Like my dad's old and he's stuck in his ways, and then you got other folks that, I've been eating deep fried foods all my life, and I'm going to continue to do it. How do you get people to change? Other than waking up after having a heart attack.
Yeah, so great thing. So people do have to be motivated. And the example I gave, the gentleman was in his 70s. So it wasn't like, he'd been eating, that way most of his life. So first of all is giving him a wake-up call. And that's what we do, some of the testing we do, because when we give a number, it's not, okay, your cholesterol's 220, that's high. It's, your heart age is 80 and you're 65.
Wow. Yeah.
Or your risk of a heart attack in 5 years is 15%. Those are numbers that people can relate to. So it starts with giving people information that they can relate to better than just a chemistry panel or you know, a number. And it has to be a number that really means something to the patient.
And you look at stress too, I would imagine, helping to reduce stress, because those are issues related to heart attacks too.
Yeah, oh, definitely. There was a journal article from Circulation in 2012. This was kind of surprising. They took people who had heart disease, known heart disease, and they randomized them to 2 groups. So one group did meditation twice a day for 20 minutes. The other group had health education instead of the meditation. And in 5 years, there was a 48% reduction, so basically cutting it in half, of dying, having a heart attack, or having a stroke.
Wow.
Just by meditation.
The
That's
no-brainer
awesome.
thing. Will you come back on and share some more tips on how to age successfully?
Sure, I would love to.
That'd be great.
Dr.
Yeah.
That's
Jacobi, thank
awesome.
you for being
Yeah,
with us.
thank you
Thanks,
for
sir.
having me. I appreciate
All
it.
right. That's great. So coming up next, we're going to have a 3-point shootout.
I know we're not really sure what we're going to be doing here on CCN Sunrise next, but stay tuned with us. I think we're going to be throwing some
We're-
three-pointers.
We're going to see who can get the garbage in the can.